Welcome to lesson number 4. In this lesson, we are going to explore the rights patients have under the HIPAA privacy rule. Understanding these rights is essential for both healthcare and IT professionals. Are you ready to empower your patients with knowledge? Let's get started. First, let's talk about the right of access. Under the HIPAA privacy rule, patients have the right to access and obtain a copy of their protected health information. This means that patients can see their medical records, request copies, and even direct the information to a third party. Healthcare providers must respond to requests for access within 30 days. In some cases, this period can be extended by an additional 30 days. Also, patients can request their records in a specific format, such as paper or electronic copies. And providers may charge a reasonable fee for copying and mailing records, but they cannot deny access because of inability to pay. For example, imagine Sarah, a patient at Surrey Hospital. She wants to review her medical records to better understand her treatment plan. She submits a request to the hospital, and within 30 days, she receives a copy of her records, either in paper or electronic form, depending on her preference. This empowers Sarah to be more involved in her healthcare decisions. Next, let's discuss the right to request corrections. Patients have the right to ask for corrections to their PHI if they believe there is an error or omission. This ensures the accuracy and integrity of their health records. Healthcare providers must respond to an amendment request within 60 days. This can be extended by an additional 30 days if necessary. If the provider agrees with the request, the correction must be made promptly. If the provider denies the request, they must provide a written denial and inform the patient of their right to submit a statement of disagreement. For example, consider Dr. Robert's clinic, where a patient, John, notices an error in his medical record that lists an incorrect allergy. John submits a request for correction, and within 60 days, the clinic reviews the request and agrees with John. His records are updated to reflect the correct information. This helps prevent potential medical errors in the future or future treatments. And finally, let's explore the right to request privacy protection. Patients can request additional restrictions on the use or disclosure of their PHI. And while covered entities are not required to agree to all requested restrictions, they must comply if the patient requests restrictions on disclosures to a health plan for payment or healthcare operations when the patient has paid for the service out of pocket in full. So let's review it more in detail. First, patients can request that their PHI not be disclosed to certain individuals, organizations, or for specific purposes. Second, covered entities must agree to a requested restriction if the disclosure is for payment or healthcare operations and the patient has paid for the service out of pocket in full. Patients can also request confidential communications, such as receiving mail at an alternative address or by different means. For example, imagine a patient at Green Valley Clinic who undergoes a sensitive medical procedure and pays for it out of pocket. The patient requests that the clinic does not disclose information about this procedure to their health insurance. In this case, the clinic must comply with this request, ensuring the patient's privacy is protected according to his or her wishes. And there you have it. We have covered the essential rights patients have under the HIPAA privacy rule, including the right to access and obtain a copy of their PHI, the right to request corrections, and the right to request privacy protection for their PHI. Understanding these rights helps ensure that patient information is handled with respect and care. Stay tuned for our next lesson, where we'll dive deeper into the responsibilities of covered entities under the privacy rule. And until then, remember to empower your patients by respecting and upholding their rights.